Hello there. My presentation is going to be over diabetes. I hope you enjoy. There are two types of diabetes. Type 1 is typically found in children and in young adults, and type 2 is the second form of the disease and is attributed to increased obesity and lack of physical activity. Type 2 diabetes develops when cells become less sensitive to insulin, even if the pancreas is performing normally and produces a normal amount of insulin. There are some complications that can arise from having diabetes as well. Diabetes can affect any part of the human body, including skin. This can result in styes, boils, folliculitis, and infections around the nails. Another complication can lead to eye problems and even blindness. With diabetes, you are more at risk for cataracts, glaucoma, and retinopathy. Lastly, there is neuropathy, which is nerve damage. Peripheral neuropathy is common, and some symptoms include tingling, increased sensitivity, or weakness in a patient's hands and/or feet. A diet that is beneficial to a diabetes patient is a Mediterranean diet. The Mediterranean diet is a plant-based diet that focuses on fruits, vegetables, whole grains, and nuts. Their main source of fat comes from oils such as olive oil and canola oil. This diet also allows for the consumption of low levels of cheese, dairy, poultry, and fish. Red meat can be consumed, but only in small quantities and sparsely. I would recommend this diet because it is proven to help improve blood sugar levels and help an individual lose weight, which will help with an individual's diabetes long term. When an individual is diagnosed with diabetes, it is important to not only diagnose the party that is affected, but their family as well. There are a few things that a patient with diabetes can do to help get a solid support system at home. For one, they can ask their family to learn about diabetes and how it affects them both emotionally and physically. Number two, you could invite the family to attend any diabetes appointments or classes with the affected individual. And number three, you can include the family into the patient's new healthy lifestyle, which also includes eating right and exercising regularly. When trying to educate a patient or their family about diabetes, there are several different teaching methods that we can use. Studies have shown that diabetes education has improved the lives of patients and their families for the better. A popular way to teach diabetes is by using visual tools. Many people are visual learners, and with the use of diagrams and pictures of what your body does when you have too much sugar can help people better understand the process of diabetes itself. Community support is also a vital teaching method. Discussing all the ways to get a patient's family involved, involving all members of the family, would help keep the patient more accountable for their health. Some different points that I would like to make to the patient or their significant other or family is that I would like to remind them that diabetes can be controlled and that it doesn't have to control their lives. Knowing the importance of a healthy diet and exercise, a person with diabetes can ultimately live a pretty normal life without any major disturbances. To ensure that the diabetes patient or their family fully understood the material that was taught, we could administer a short comprehensive test to ensure that they know the most valuable information that pertains to living a healthy lifestyle with diabetes. Even enrolling the patient in a course where they completed modules that showed them all the important information about diabetes would be an efficient way. The following are some points that are specific to the disease process of diabetes and are related to nutrition. Number one, many individuals with diabetes are overweight, and this can be directly influenced by nutrition. Lacking a healthy diet can cause one to eat foods that are high in calories but low in nutritional value, causing them to have a high caloric surplus. This can lead to individuals being overweight. Number two, diabetes is high blood sugar levels, and this is influenced by eating starches or foods that are high in sugar. So consuming less foods that are broken down into sugar quickly would allow for an individual to have better control over their diabetes in the long run. And number three, it is important to live a healthy life with diabetes. So for one to live comfortably this way, one must consume a well-balanced diet that is low in sugars and other types of fats, and they must consume more fruits, vegetables, and whole grains, which would allow them to have better control over their blood sugar levels. The following are a few ways that I could advocate for my patient and or their family. Number one is to determine what my patient wants and what they're seeking out of treatment and helping them find a way to achieve just that. Number two would to be assertive when need be not only to the patient but to the family as well. And this pertains to their meal plan and their exercise routine to ensure that they are taking the process and diabetes protocol seriously. And number 3 would be being able to teach my patient how the process works. And so advocating for the best care would be to educate my patient on how to deal with their diabetes and how to improve it so they can live a long and healthy life.